Welcome to HealthTech with Purpose podcast. Our today's guest is Lee Jones, Chief Product Officer at Gozio. Gozio is a company on a mission to transform healthcare through human-centered technology. Lee brings a wealth of experience from his work in various sectors, and today we'll deep dive into the future of healthcare and how Gozio is making a difference. Stay tuned. Hi, Lee. Thank you for joining us on our podcast, Health Tech with Purpose. Today, learning from you, we are really looking forward to your experiences of an illustrious career that you have built over the years and the different things that you've done. And, as a product owner at Gozio, we would really like to understand more around your day-to-day stuff, and how you see healthcare and what drives your purpose. Welcome to Health Tech with Purpose.
Thank you. That's kind of you to say. I don't know if it was illustrious, but it happened.
We'll get to know. Great. But thank you so much. I know the answer already. I mean, our audience will get to know. So, well, thank you so much. And, as a chief product officer at Gozio, why not we start with that? Tell us a bit more about your professional journey, where you started with and what led you to become eventually landing as a chief product officer at Gozio. Was that always you were planning to do, or was it by chance?
No, no. That's a great question. No, none of it was planned at all. The whole story starts a long time ago when I was living here in Austin, Texas. I had just finished graduate school. I was working at a small computer company as a mechanical engineer, and I met someone at a lab bench. His name was Joshua Titus. He's the CEO of Gozio. So he and I met in 1996, and we were working together at this little company building these revolutionary computers at the time. And we were just young engineers full of everything young engineers are full of, building things and going out at night and going to see live shows here in Austin, and then getting up early and doing it all over again, riding our mountain bikes, living life. And so that will all make sense at the final step of why am I at Gozio today? And then Joshua moved to the Bay Area, and he worked for a succession of really interesting companies out there. And I stayed in Austin and did the same thing. I worked for a lot of high-tech startups. And along the way, your career, you just basically get more and more responsibility. I've always been very bad at sensing danger. And so when management comes in and says, hey, we need somebody to do this, I always say, I'll do that. And if I had been in the military, I probably would be dead 1,000 times over, because I would have volunteered for too many things. But I volunteered for these things, and I got more and more responsibility, and ultimately was leading and managing engineers for a few years, and got to do some really fun things along the way. And then 10 years ago, Joshua and the other founders started Gozio, and he called me. He and I stayed in touch. We were in each other's weddings. I mean, we've stayed in touch for a long time. And he said, hey, we're starting this company, and you've worked at a lot of really small companies that are starting from zero. Would you be willing to be an advisor to us and help us figure things out? And I said, I'd love to. And so I did that for a long time. And then in 2016, I was taking a break from work. I'd had enough. And so I was taking a break, and Joshua said, how would you like to come volunteer at Gozio for a while? We're getting our first customers. We're strapped for management bandwidth. And I said, I'd love to. So I worked day to day with them for about a year, and that was super fun. To do that, I worked as the chief strategy officer at the time, but we were just doing, it was the nuts and bolts: get clients, get customers, find value, build the product, deliver the product, and then fix everything that you thought you got right, but you now realize customers need it to be different. And then I took a break from Gozio. They were still growing the company, and it wasn't really big enough for me to do anything super meaningful. And so I went and did a 90-day consulting job at Bose Corporation up in Boston, Massachusetts, which turned into 5 years of working at Bose. I was only supposed to be there for 3 months, but it blossomed luckily into an amazing experience. And I worked in research and development there and met a lot of great people. I assume you're familiar with the brand, but you know, they make noise canceling headphones and sound bars and
audio. Yeah.
Yeah, it's an incredible company. And I worked in a different part of research. We worked on health and wellness products, which was an experiment the company was running at the time. And that was so fun. I could talk about that for days. And then about a year and a half ago, I left Bose. They changed their focus and decided to refocus themselves on audio and focus away from health and wellness. And so I left. And Joshua called and said, "Hey, why don't you come spend some more time with us at Gozio?" And so I said, "Okay." And again, I've got a little bit of a jack of all trades background. So the idea there was come in and meet all the people and let's figure out, it's a growing company. There are holes and shortcomings and places where we need help everywhere. Pick one and work on it. And so we came in and agreed there's a good fit in the product category. I'd managed products at Bose and done other things. I've always had a mix between a technical role and a explain things to customers role. And so that's what I've been doing. So for the last year and a half, I've been the chief product officer at Gozio Health and having a blast.
Great, great. Thank you so much for sharing the journey with us. Different experiences. So, Lee, you are at a place now. Gozio is an impactful company. The sheer scale of operations that you guys do are pretty amazing. What I would like to know more is, from your lens now, seeing things at scale, probably having millions of users interact with your platform every day. Um, how do you see healthcare and wellness industry? What are the biggest challenges you see, and what are some of the solutions or possibilities that you see?
That's a good question. We look at that every day. The irony of our situation is while we may have millions of people using our technology and our products every day through our clients, their hospital mobile applications, it's still intensely personal. Every single one of those interactions, every job to be done is for one person trying to do one thing. And so it's fractal in nature, right? You zoom way in, you're trying to solve a little problem, you zoom out, you're solving the same problem for the organization. Fundamentally what we do with our technology, with our products and our solutions is, and this is at the highest level of abstraction, we attack and eliminate uncertainty and wasted time. And if you've experienced healthcare, we operate only in the United States today. It is full of uncertainty and wasted time for everyone. I mean, there's medicine, uncertainty, and wasted time. Those are sort of the three elements of the healthcare experience in the United States. Thankfully, the medicine is excellent, but holy cow! So you're confused. Where am I trying to go? How do I get there? How will I know when I need to leave? Where are my medical records? Who is my doctor? How do I find a doctor? How do I choose an urgent care? There's all these decisions you have to make. And we ask people to be consumers, but to be a consumer, you have to understand what are my choices and then how do I rank order those choices to make the one that I think is best. And so we work to bring as much information to the end user, the patient or their family or their visitor, to help them find care, choose care, navigate to care, come home after care. And then on our platform, bring all the information about that to the hospital system so they can see how do their customers do those things? How do they access that care? What do they like? What don't they like? So the biggest challenge, and I feel like this is maybe the human condition, so we'll get to work on this forever, is dealing with confusion. It's just there's just so much information. It's easy to get confused. How do we simplify that and then put it into a sequence so that people can solve that problem and solve the real problem they're trying to solve, which is to get well, to be healthy. And so we often wrap a lot of overhead and complication around the most important thing, which is our well-being and our health.
Right. True. So tell me more, so when you have all of this data coming in, it may become a bit overwhelming as well, especially as a product officer who has to make decisions like what goes inside the product, what may have to be eliminated too. So how do you, make those decisions from, a CPO's insight? Like, how do you decide what are the priorities for the company, what should be the priority for the product or the team, and what should not be as well.
Yeah, that's a really hard situation, right? Because humans have a tendency to jump right into a solution, and then we have all kinds of cognitive bias that makes our decision making faulty, recency bias, confirmation bias, all these things. The way we do this at Gozio is we just back it up to sort of some very basic first principles, and we focus on three things. We have a foundation, and then two very important objects that rest on that foundation. I'll start with the objects. The objects are, the number one object is, what are the problems people have? So many times it's very easy to suggest solutions. It's very hard to understand what's the real problem here. And so if you're in product management for any company doing anything, you have to dig into what is the problem you're trying to solve. And it's usually deeper than what people initially tell you. And this is why I mentioned at that most fundamental layer of uncertainty or wasted time, those are about emotions. When you experience uncertainty and wasted time, you feel bad. And when you feel bad, you're unhappy. Now, when you experience confidence, when you experience efficiency and you do less work for better results, you're happy. Good things happen. So we look for problems, and that's where people are unhappy. And then you just flip that. This is not complicated. You make that problem go away, and then they're at minimum neutral, and ideally they're happy if you do a good job. So that's piece one, find problems. Piece two is listen. So when we're trying to understand, especially in product, we're kind of the ears of the whole product development process. We have to listen to the client. We have to listen to the end users. So, hospitals are our customers. They buy our product. But people like you and I are the users. We use the hospital's mobile application. And so you have to listen to those people. We have to listen to our engineers. They bring us reasons why things are easy or difficult, slow or fast. We have to listen to our investors. They have really interesting market insight and advice for us on, you should be thinking about these kinds of clients or those kinds of clients. We have to listen to ourselves in terms of our prioritization and everything. So find problems and listen. That's it. And then the sublayer, the foundation upon which all of this rests, is a big, big, thick layer of humility, because we have to constantly remind ourselves that we might be wrong. And by finding problems and listening, then we propose a solution, and then we listen again. And we find out if we're right or we're wrong. And so there's an iterative feedback loop that if you don't have a little humility, if you don't just go through life a little bit skeptical and leaving the door open that you might be mistaken, you'll stop learning. And so we have to always be learning. So humility helps us do that.
Right, makes sense. But can you elaborate it further? Maybe any incident or a story that comes to your mind where, let's say, similar situation happened. For example, you had to, make those choices, or you had to listen for finding a better solution than what you had anticipated. Anything? Yeah.
Yeah. This happens all the time, and so I'll give you without going into specifics, because I don't want to reveal client confidentiality. We had a client that wanted us to. They came to us and said, "You need to build this." So they showed up and prescribed a solution, which is all in product management. That's already a warning sign, because the odds that that's really the answer are small. And so you have to listen to that person. We listened to them. They told us what was happening. We found the problem. We came back and we said, think this is the problem and this is the solution you would like. They said yes. And it turned into a very complicated piece of mobile development that we needed to do. We were going to have to link 2 or 3 databases. We were going to have to create an entirely new user interface. It was going to have to be prototyped and user tested to make sure that we had the right things in the right places, and all the work, all the design work, which is so critical to this. And we had all that teed up, and then someone came to us and said, this software actually has a web version that renders beautifully on mobile already. And so it turned out we needed a link. And now you have to put a user interface over that link so that it's plain English and a person can tap it. But then when you tap that link, It serves the website. It's beautiful. It solves the website they did a great job on making it render well in mobile. They were proactive and highly skilled.
Right.
And so all the things we thought we were going to have to do, all the time we thought it would take, all the expense we thought we would incur and have to pass on to the client, all of that disappeared.
Mm-hmm.
It just became a link. And so we have examples of that quite frequently where we think it's very complicated and it's simple. And then the opposite happens where someone says, I think you just need a link. And then we look into that and we're like, oh, this is so much bigger and more complicated than that. And it goes the other way for us. And we actually have to go design the user interface and do the user research and all those things.
Right.
So that's where the humility comes in. You have to consider we might be wrong.
That's right. True to the code. So how many teams, or what's the size of the team that you run? Like, is there one team that's your product team, or there are like multiple product developments happening, in parallel?
It's like a multi-tool. It's one thing, small team, 7 people, not that big, but everybody on the team has multiple talents and multiple abilities and multiple responsibilities throughout the product portfolio. So it's again a Swiss Army knife. You can open it up and do many different things. Our team is that way, deceptively small,
A team of
but
hustlers.
very flexible.
Yeah, I'd say a team of hustlers then.
Yeah, that's true. They're the people at Gozio are fantastic. They're almost to a person. Everyone is very thoughtful, very intelligent, and excited to go do more than one thing, right? We don't have a lot of people that just wear one hat and say, this is my job, this is what I do. They say, okay, this needs to be done. I'll help find a way to get it done.
This episode of HealthTech with Purpose podcast is brought to you by MindBowser, a product engineering and digital transformation company focused on health. At MindBowser, we enable health companies to build the future of health where accessible, equitable, and patient care.
We strongly believe that technology can empower a healthier world, and that's why we are partnering with healthcare experts like yours to make it happen.
Hi guys, thanks for listening to HealthTech with Purpose. Make sure to subscribe us on Spotify, Apple, and YouTube for more expert insights on industry innovation and transformation. And remember, share the knowledge.
That's interesting, and I
way to
think
work.
that's the ideal culture that I believe any startup or any larger company wants. So tell me more about your practices that have led to building that culture within the team, the creativity, the getting things done attitude, or taking ownership. So how have you inculcated? Because I think it all eventually depends on the leader. So
Yeah, it kind of does, but I think it really depends on the people. A little bit too much leadership can be a bad thing. So the way I like to think about this fundamentally is it's the important thing to do is to get things out of people's way. So I worked for a long time, not a long time, but I worked for many years as a organizational development consultant. I took a sabbatical from engineering, and I would travel around and go visit companies and interview 100 people over the course of a week, and then tell their upper management, here's what's wrong. And there was a repeated set of findings that it got to a point where I could always write half of the report before you told me the name of the company. And the issues were communication, people aren't sure where they belong, and motivational problems, usually from too much management. So there's too much process. You're making me do too many things. I can't do my job. You've asked me to run a marathon, but you tied my shoes together. And so a lot of times you need to just come in and untie people's shoes and let them run, get things out of their way. So all of this, everything I'm talking about, it's just about people. And so you have to get to know, I said earlier, what we do is millions of users, but everything is individual, very personalized. Teams are the same exact way. So you could say, oh, it's a product team. There are product managers, product owners. There's a person who's running Scrum. There's a person who's making sure the ceremonies run on time. People are looking at all these things happen. These are the mechanisms of all these things. These are people. And so all of these people have a way they like to work. They have a communication style. They have a way they like to be thanked. a way to be interacted with. And they have hot button things that are triggers that will frustrate them and make them perform poorly. And the only solution is to get to know the people. And so that's priority number one, get to know the people. Now, what we do culturally as a company, Gozio is an interesting company. A lot of this comes straight from the founders in that we do planning and then we do adaptation. And so some companies don't plan, they only adapt. They're like, why plan? Because the future is uncertain. Anything could happen. And there's another group of people that plan, and then when the future changes, they say, too bad, future. We don't care what reality shows us. We're going to follow our plan. Now, both of those examples, those companies die. They don't make it. Our methodology is one of we plan, and then we know we're wrong. So one of the jokes is, as soon as you come up with a detailed plan, you've eliminated one possible future because you know that's not going to happen. And so then the process of planning makes you ready to adapt very rapidly. And so everything we do is iterative, it's cyclical, and it's geared around, this is based on what we know today, we're going to take this forward, and we're going to go see our clients. Like I said, we're going to assume we might be wrong. We're going to go listen and listen again and listen one more time. And then we're going to adapt. And then we're going to do that again. And so whether it's how we manage a team, how do we onboard a new employee, how do we bring up a new client, how do we sell, everything we do, there's a plan, and then we adapt it to whatever that situation is based on those individuals, their needs, and then whatever the situational reality turns out to be. So it's not super complicated or high-minded or anything, but it works. Yeah.
Yeah, but I think you described it very, very in a language, very much in a language which makes it look easy and applicable, which is good actually. I liked it because it gives the strength to any listener that yes, this can be applied. Maybe I can think of my team this way. So that's great.
It's actually real quick. It's actually the hardest thing. It looks easy, but it's the hardest thing, which is people. And so you can't, eventually, if you manage people or you lead a team, you'll have a day where you come home and you'll think, wow, this would be easier. There were no people here.
Right.
But
I do myself do it faster.
we all feel that way sooner or later, right? And then you realize, oh, but wait a minute, we're doing this for people, with people, and so the people are what really matter. And then that gives you sort of a renewed energy to go back in, focus on the people, and then the people will take care of everything else.
Right. It's more about like finding good people and allowing them to do good things rather than telling them what to do.
Well said. That's exactly right.
Yeah. Great. So Lee, I think in your career you have been coached in also one of the best companies or greatest companies of the last century, Boss, which still continues to innovate and bring new innovations to the market and do new things. So and you spent like good 5 years at Boss. So tell us any of the learnings or any of the stories from those times.
I wish I could tell you more, but it's a very confidential company, and a lot of the work I did was in advanced or future-looking research, so I can't discuss a lot of the work. But I can tell you a little bit about the culture that is in place or was in place at that company, and it is fundamentally a good way to think about it is almost a childlike fascination with the universe. And so coupled, think of it as playful scientists.
Mm-hmm.
is really fundamentally what I experienced there. And you have people that you can go in the cafeteria and sit down at almost any table in the R&D building, and you can have a conversation about physics with people. You don't have to know their name. You can just start talking about physics, and they can talk back to you about physics and teach you something. So everybody there's super smart and very kind and friendly. And combined with a focus on audio and a desire to do amazing things. What happens if I do this, right? This is the way children approach the universe. What happens if I do this? You watch kids on a playground or in the woods or something. They pick up sticks. They walk into water. What happens if I do this? And so that's what research is really all about, especially at a company like Bose. The beautiful thing there is if you think about that in terms of innovation, we often have the wrong idea. You think, well, we're going to have to get a bunch of PhDs if we want to do innovation, and we'll have to create a different building and have a different environment for them. And that's simply not true. And this was true. This was Bose doesn't believe that. And I don't believe that. No, I don't. I think most people that have really done innovation know how false that is. The reality is it comes from everywhere. And so when you think about innovation and the things, we do this at Gozio, we have essentially a process and we have a culture. And the culture is one of listening with humility. And so anybody in the company can have an idea for how to solve a problem for our customers. So we have people that are in the field all the time. They're at hospitals, they're doing installations, they're watching people use the software, they're listening to what people say. Now these folks they're not officially innovation officers. They don't have PhDs from MIT or anything. They have common sense and they listen to real people and they have ideas. So our process is one where anybody can come in to the product team with an idea. We don't care where the idea comes from. Like we're agnostic, right? So everybody's an innovator. And then our job is to use our process to not lose the good ideas and make sure we get the right ones built in the right order. So innovation comes at us from every direction, right? Think of us at the center of a sphere. It's just constantly coming. And we have a very lightweight process that we get things into our tools, right? We use Jira like everybody else. We have prioritization matrices where we rank order things. We have arguments. Is this more valuable than that? Or how should we move things? But the beautiful thing is we never lose anything, right? This is what's great about a database. Once you put it in the database, you can relax. As long as you can query the database, you can get things back. And then it's all about prioritization and building things in the right way. And then figuring out the fit with the end user. So sometimes we solve a problem. We solve the right problem the wrong way. We have to adjust it and make it go back again to make it fit. But fundamentally, that innovation comes from everywhere. And Bose embodied this. I mean, you could go, there's a long hallway there that you can walk down, and it's just patents. Now, the hallway's 250 feet long. The patents are 5 or 6 plaques high, and they stretch the entire length of the hallway. And so you can walk, and you will see certain names. You'll see Amar Bose. You will see there's a gentleman named Tom Freshley. You'll see his name. There's guys, we call them Joe V. These are early folks in the history of the company that invented a lot of things. Joe Varanth. These folks, their names appear very frequently, hundreds of times. However, you will see all kinds of names, and they are laboratory technicians. They are marketing people. They're, different people had different ideas and they contributed. And so that innovation and that innovative spirit comes from everywhere. You have to be open to it.
Right. Great. No, that's good to know and very inspiring, in fact, especially, about the patents that you say. I can just imagine the kind of awe one would get in.
They stretch back 50 years. So you can see the very first patent that the company ever received, and they go to the present day. So I can go down that hallway and I can see the names of the people that I was in a meeting with 20 minutes ago on that wall, and I can see the employees 1, 2, and 3 as well. It's a very nice reminder, and it's a touchstone, right? It's the path the company has taken, but it's a reminder that the innovation never stops. Potential's always there.
Yeah, good pictures too. Good scenery to imagine. Nice. Greatly. So, I'm going to change gears and would like to know more about the future. So,
Me too.
what are the yeah. So, what are the top trends you are counting upon to solve more problems in healthcare? We all know healthcare is sitting on a this giant bubble of problems where there's always that push and pull going around, and it's the consumer most of the times who's actually getting in the mess. So what are the technologies or what are the things that you see and you are really putting your money on that this is something probably could change, or this is something which would solve, and so on.
Yeah, that's a fun thing to think about. Like everybody, we're thinking and talking about artificial intelligence. The revolution that GPT enabled in the last 12 months for all those of us in the public, and that's been happening in the background for about 5 years. But these large language models and what we can do in terms of exchanging, interpreting, and generating text for people is a big deal. So we spend a lot of time thinking about what's the right way to work with that kind of technology. As a platform, we're not actually trying to develop any AI technology. We are trying to find the right partners for our clients to help them understand what should they integrate so that they can take care of their end users. So that's fast moving, right? That's all of us are trying to make sense of that. None of us know what's really going to happen in the future, which is where our planning and our adaptation come in. And then the other thing that, the future that we're excited about at Gozio right now, this is less a technology and more just a job to be done, is we're very focused on staff. So we had a patient experience revolution that occurred sort of through the 2010s, where we started to finally think about patients as people with feelings, and the Affordable Care Act and HCAP scores, it drove this in the United States, where the amount of money you were reimbursed was a function of how happy people were. We have managed and value-based care, where the amount of profit you receive is a function of how well you treat that person, and you prevent them from coming back to the hospital over and over again. So those things are happening for patients. And the pandemic just blew this wide open and showed us how precarious the situation was. We're not taking care of the staff. And I don't just mean physicians, although they're part of this, nurses, clinical assistants, administrative staff, housekeeping staff, security, everybody that works at the hospital was just stress tested to their limit during the pandemic. And it exposed all, like so many things, right? A stress test exposes the weaknesses. And so it showed us that we were taking these people for granted in many cases, and that we were overloading them with work and really administrative overhead. You'll hear different things from different people, but fundamentally what you'll hear is, please untie my shoes. I can't run. And so we're very focused at Gozio and with a handful of our clients right now on a staff experience product that uses our existing technology and enables us to go find ways to do less with staff, right? They need to do less. If you show up and say, I'm from the technology department and I'm here to help, forget it, right? They'll slam the door. The goal is to go, again, remove uncertainty and remove wasted time. So we're doing a lot of user research, and we're building prototypes. We're doing controlled deployments with people to go find the wasted time and the uncertainty in the staff experience and drive that out completely using mobile, right? So in the palm of your hand, we go make their jobs easier, less friction, less complication. Oh my gosh, is that a big problem? So rewind your mind to the early 2010s, when we started to think about how to make life better for patients. It's just the most basic things, like don't wake them up 10 times in the middle of the night. Don't have announcements from the parking deck blaring in their rooms. Give them better food. Tell them what their appointments will be throughout the entire day. Like very basic things that were not happening a long time ago, that at more and more hospitals, you see this. And a fun way to think about it is to view them as guests as opposed to viewing them as people or patients. They're guests. And so how would you treat a guest versus how would you treat a person who shows up and just shows up in your house? Very different. And so the staff need that same treatment. So there's all kinds of low-hanging fruit, very simple problems to solve. Different clients have different priorities, different things they want to do. And so there's no right answer. So we tailor our integrations and our platform to solve one problem at this client. And then if you pivot to a different client and they say, no, we don't have that problem, we have this problem. And so we have to tailor a new solution. So again, that's where the adaptation comes from, right? You have to have a very flexible suite of technologies so that you can solve different problems in different ways.
Nice, nice.
I don't know if I answered your question, but the future we think is taking care of staff, and we are all in on that.
That I think is the biggest takeaway, from the answer, and that's interesting because again, coming from a company like Gozio, which has done pretty good in solving the patient care, the interactions. I think you definitely would have some lessons that you can take to the other side and be able to make the world better on the other side.
It's people. It's all. I mean, I may be a broken record, but we discovered patients were people. Turns out staff are people too, and treating them with dignity and respect, and not wasting their time and not confusing them.
Mhm.
They like that. They like to be treated well.
Right. So last question to you, Lee, that, again, a bit more personal question to know more of Lee as the person, the people behind, as you said. So, Lee, what are your personal goals for the next 2 to 3 years? What are you planning to do? Are you, any goals that you can make public? Like, are you planning to run a marathon? Are you, what are the things that you are up to?
I've made a lot of goals in my life. I've achieved some, I've not achieved others. I don't really have any more goals. I've run out of goals, and I instead have sort of 3 criteria that I seek. And so for the next 2 to 3 years, I want these to be present in my life. This is my professional life. Personal life, I want happiness. I want my family to be healthy. I don't want any bad luck. But we all feel that way. When I'm involved in a professional project like Gozio or Bose or any other company that I'm working with or for, I care about 3 things. I want to work on really hard problems. I do not want to do the easy stuff just is boring, right? And so I don't like to do that. I want to work on really hard problems. I want to work with really smart people. I need to be able to have conversations and have people challenge me. My goal is, and this becomes easier as I get into a higher and higher class of company, I like to be the dumbest person in the whole place. That's my goal,
Right.
to be the weakest link. And then, which is scary sometimes, but it means that if everybody's better than me, that means I'm going to learn. Sort of like sports, right? You want to have a practice partner that's better than you because that will force you to get better. So I want to be with really, really intelligent people, and then on hard problems. And then lastly, the people need to be nice. So I can't work with jerks and rude people and narcissists and harmful, malicious people, sociopaths. I've got zero tolerance for all that. So when I have those 3 things present, really hard problems, really smart people, and the people are nice, what I've learned is I harvest energy from my job. And so I wake up in the morning excited to do whatever it is I'm going to do that day for that enterprise with those people. And then at the end of the day, I'm almost a little reluctant to close the laptop and say, okay, because I'm going to miss it and I have more energy, right? So then I leap up from my desk, I go see my family, and I feel better than when I came in because I stole energy from my job. It made me happy.
Great. So that's a great way to put, and it really speaks volumes of a very experienced and great mind who has learned his lessons well.
Yeah,
So,
exactly. The experience day to day is what matters, and that's again people, feelings. It's how we work. So that's what I focus on.
well said, Lee. Thank you so much for this hour of wisdom, and we really cherish this conversation. Hopefully, our audience would like it too. So, thanks so much again for joining us today.
Thank you so much for the podcast and all the hard work you do to talk to different people, synthesize all the information, share it with others. I know it's a lot of work, and I'm really grateful that you took the time to do it, and I'm honored that you hosted me. Thank you so much.
Thank you for joining us on the HealthTech with Purpose podcast. Before you leave, make sure to like and subscribe on Spotify, Apple, and YouTube. And if you would like to see someone on this podcast, do refer to us. My contact details are in the description. Before I leave, I wish you stay healthy, stay curious, and keep building.